Hello, everybody, and welcome back to another episode of Anxiety Chats. Today, we are joined by Shawna, an anxiety advocate who has herself experience with health anxiety. So, welcome, Shawna. How are you
I'm
today?
great. Thank you so much for having me. I'm so excited. This is my first time ever speaking on a podcast, so I'm honored that you reached out.
So great to have you. I actually watched something that was, I think, the link in your bio, which was like a short. Was it like a news thing that you were on?
Yeah, it was actually one of our the CTV. So I believe it's the Canadian news television, I guess. They had reached out over Instagram asking if I would be interested in doing a news segment on my experience with my cardiac arrhythmia, how I was misdiagnosed, and how it affects me now. So that was pretty neat.
It was really interesting, and usually we ask for guests to say their story at the end. But I thought with us, it maybe be cool to start with you telling your story about being diagnosed with health anxiety and going to the hospital a couple of times,
Yeah.
and them saying this is just a panic attack. Also want to say here there is no just with a panic attack. Panic attacks are terrifying.
They are. They're
Um,
awful.
but actually, you found after being there a couple of times that actually it wasn't a panic attack and it was something that was wrong with your heart.
Yeah. Yeah. So it started in, I believe it was it was 2019, I believe. And there was this night where I came back from a yoga class. So I was feeling pretty zen. I wasn't feeling like anxious or worked up or anything. And I was folding laundry. And as I was folding laundry, suddenly I felt my heart start racing as if I was like running a race. And I thought, oh my goodness, this does not feel normal. I don't know what's happening to me. Am I dying? Like I truly thought that I may die on my living room floor. So my husband was in the garage. I called him in and I said, you need to call an ambulance. And he's like, just relax, who knows what's happening. But anyways, so he brings me up to the hospital and I get there. And of course, my heart has settled since. It settled on the way in the car. And they had said, do you want an Ativan? I don't know. Ativan might be called something different where you are, but it's an anxiety med. And I said, no, it's something cardiac. Something cardiac is happening. And anyways, they sent me home and they said, follow up with your doctor if you think you need to. Well, a few months later, it happened again. And same thing. I went up to the hospital and they put a heart monitor on me and they said, no, it's a panic attack. So I'm like, nope, I went through this before. This isn't a panic attack happening. Finally, there was a day, it was actually Canada Day. It's a holiday here where I was at my in-laws and they live on the water. And I remember sitting there, I had a drink and a bunch of us were going to go swim out to the water trampoline. So I got up, I was running in the water. I got about waist deep and I felt my heart skipping all over the place again. And I thought, I'm super relaxed. I'm having a really fun day. Why am I having a panic attack now? And I was like beating myself up over having this panic attack in the water. So I swam out to the trampoline and I thought, okay, like I'm going to have fun. This panic attack is going to ease. It didn't. So swam back in and I like walked up the hill to the house and my husband was like, what's happening? I'm like, my heart is doing that thing again, but it's not stopping this time. And he's like, okay, well, just take a couple of deep breaths. The doctors have told you that this is just panic. And I said, no, I'm telling you, it's something with my heart. So after about 5 minutes, I realized it wasn't easing up at all. So we did call 911. Now because my in-laws kind of live out in the country a little bit, it took a little while before the ambulance got there, but I ran out to the ambulance. Like physically, I booted it out there. And I said, hook me up to a monitor because I don't think I'm having just a panic attack, as we'll say. I'm like, I think there's something medically happening. So they put the monitor on me and they're like, no, you're right. Like your heart is in AFib. So atrial fibrillation, which is a cardiac arrhythmia. And they said, we got to put the lights on and get you out to the hospital. So it was, I'm going to say that day that I got diagnosed with the arrhythmia, it was a relief to me because I was starting to question myself. I was starting to think, okay, is this really what a panic attack feels like? Like, is a panic attack only in my heart? I wasn't sure what was happening, and it was so frustrating not getting a diagnosis. And I'll also mention, I do work in the medical field. I am a registered nurse, so I do have some experience with this. And my brother also had the same cardiac arrhythmia. And it was numerous times that I was brushed off. I was told things like, well, it could be hormones. When is your next period? Are you on your period? You're probably just stressed out and overworked. You're a full-time nurse and a mom. So maybe you should take a little leave from work. Like the things that I was told were ridiculous. And the flip side is as a result of my cardiac arrhythmia, I did in fact end up developing anxiety. How could you not? It's when you feel a vital organ bouncing all over the place in your chest. I mean, it's bound to cause some anxiety. But I'm on the flip side of it. From the time that I was diagnosed until now, it has been some dark days with health anxiety. Anxiety about my heart. I went through this phase where I was convinced I had ALS, convinced I had cancer, convinced I had a brain tumor. I mean, you name it, I went through it. But I'm on the other side of it. And I'm hoping that with my story, maybe I can help some other people realize that it's common. It's a lot more common than we think. There's a lot of people out there struggling with mental illness, and there is help out there. There really is. That's my story in a nutshell.
There so is. And thank you so much. It's so interesting. And the thing that I was worried about is, somebody listening right now, they might be thinking, yes, that's me. I have that, but no one's listening to me. So things like, when you were convinced you had cancer and things like that, but they weren't actually true. Yeah. That must be quite difficult because you had been through something that ended up being true, which I imagine is most people with health anxiety's worst nightmare, yes. Is realizing, okay, so I was right about that. So maybe I'm right about all of the things and they're just not testing me properly. So I just want to reassure any listeners that have health anxiety that just, sometimes it can come true, like in your case, Shawna, but it doesn't always mean if you have a gut feeling about something that it necessarily is true.
Yeah, you're right. And sometimes I am hesitant to share that story because I don't want to cause people more anxiety. What I want to do is I guess really encourage people to advocate for themselves. If they feel like something is truly wrong and they're having ongoing symptoms, then reach out to a trusted health professional, reach out to a family member or somebody. And it's hard, right? Because anxiety and panic can cause a lot of physical symptoms as well. So it's really hard to navigate what is a true medical emergency, what is anxiety, and they each affect each other. So my best advice is to just, you got to be your best advocate. You got to be your own advocate.
I think that's a really great piece of advice, especially because even if it ends up that an individual has quotations just anxiety is a medical thing that also needs to have help, whether, when you were in the hospital and they were saying things like, it's just your hormones, it's just because you're a mom, it's just because you're working too much. All of those justs should be erased because even if it ended up that you didn't have issues with your heart, it obviously was causing you so much distress that you should have been helped, even if it was just anxiety. There needs to be something in place for if a woman's coming to the hospital multiple times, even if it ended up being anxiety, there's obviously cause for concern. There's obviously some kind of help that needs to happen there, and not just be brushed off with, especially periods. Like,
I know.
come on.
I know. It's a huge pet peeve of mine. I feel like as a woman, I mean, anywhere from being a teenager to being like even into menopause, it's almost too easy for medical professionals to slap the hormone issue on us. And, is it an easy way out for them? I don't know. I don't know what the reasoning is, but I hear that all the time.
Again, even if it was a period, it was your period or whatever it was that's making you feel that way, that's not normal, there's definitely a normal period, and obviously everybody's periods are slightly different. People have different levels of pain, and there's definitely, a whole host of different things that can happen. But if somebody's having, heart palpitations during periods, then that is cause for concern. It's like, it's just so annoying that women, I hear it all the time, women being brushed off.
Yeah.
Especially women with things like endometriosis, which can cause severe anxiety in people.
Yeah.
Being brushed off with, it's just a painful period, and end up being diagnosed with cysts on their ovaries. I just think women aren't as believed as men sometimes when it comes to health.
I fully agree with you there. Actually, in at the local cardiac hospital I go to, they actually do a special fundraiser to raise money to go towards women's heart health, because so much of the medical world is focused on males, and there's so many different traits between like the female body and the male body, hormones, just our muscle mass, our the amount of fat that we have. There's so many differences, and we need to start looking at the female body as well. And I really like it that my local heart hospital, the Ottawa Heart Institute, does that. It makes us feel seen, and it makes us feel important, and maybe like there's some change coming.
Definitely, yeah. Yeah, because, I was just saying to my friend today, nature can be quite sexist, and like we have, women do have extra things that we go through, and, periods are one thing, birth is another thing, menopause, there's so many things that a female body goes through that a male's body doesn't. And so I think there does need to be, more investigating into, like you said, a lot of the research and stuff has been on male bodies so far. And yes, also things like anxiety. Women are much more likely to experience anxiety. Not that men don't experience anxiety, but that's not something that should just be pushed aside. I think when the word anxiety is brought into the conversation, people then have the attitude of, well, they just need to get over it, or they just need to, find coping skills for them. It's very much brushed off as something that's not a big deal. And like you said, you were talking about after going to the hospital and stuff, you then had some pretty difficult times with health anxiety. So how would you describe health anxiety?
So for me, health anxiety very much presented itself with me obsessing over physical symptoms. They were normal physical symptoms as a result of anxiety. At the time, I didn't know that. I didn't really know that anxiety would cause so many physical symptoms. Even as a nurse, I've been a nurse now for, 15 years. And, I see so many patients with anxiety and depression and other mental illnesses. But until you are in it, I truly believe it's so hard to know what anxiety feels like. I really just thought anxiety was like excessive worrying. I didn't know that it presented itself so physically. So after I started having some of this anxiety, I started getting really bad headaches. like a tension headache all around like the base of my head. And I remember really worrying about that because I wasn't someone who experienced headaches before. So I thought, oh my goodness, why am I having these headaches? Why does my head hurt so much? And then at times, almost like my eyes would have difficulty focusing. I felt like my scalp hurt. It felt like my hairs were being pulled. And I thought, this has to be a tumor. Like I must have a brain tumor. And I was really, really focused on that for a long time. I was constantly touching my head. I was constantly like testing out my eyes. I would like cover one eye and be like, okay, can I see that writing? Can I see that stop sign or that street sign? I remember at one point thinking, I feel like this is like a Britney Spears moment, but I remember thinking maybe I should like cut off all my hair so that my hair isn't pulling on my scalp. Like that was literally a thought of mine. and I remember one day, so I'm a home care nurse, so I went into a patient's home who had like some type of brain injury. And I remember leaving there and I was just shaking. And I thought, oh my goodness, that is going to be me. And what are my parents going to do? My dad had just had a massive heart attack and like a huge surgery. My brother was dealing with his AFib stuff. He was going through testing and treatment. So I just thought my family has so much on right now. They have so much worry. And now I probably have a brain tumor. And it was awful. I was Googling all the time. I mean, any free minute that I had, I was Googling brain tumor, signs and symptoms, brain cancer. Then I started experiencing like some muscle twitches. And that's common. I mean, whenever we're anxious, we're really tense. And your muscles just do twitch. And the more you notice it, the more you notice it. So then I got onto this kick of I have ALS. Like I must have ALS. This is like the worst thing. And I started Googling that. And sure enough, if you're reading all of these signs and symptoms over and over again, you're going to start to convince yourself that you're experiencing it. It's almost like the red car scenario. You know, if you buy a red car, suddenly you're seeing a million red cars on the street. You know, it was kind of like that. And I went through so many illnesses over the course of a year. And it's almost like I was catching on. I started to be like, okay, this month I'm worrying about breast cancer. I have cysts. And I was like, what if this isn't just a cyst? What if this is a tumor? And then part of me, the logical part of me was like, okay, Shawna, let's just get through this breast cancer obsession. Next month, you can focus on something else. And it was really hard having like the logical part of my brain fighting with the anxious part. And I didn't really know who to believe. And I was going to my doctor's office way more often than I needed to. And I was seeking validation from anybody I could. You know, one of my good friends is a family doctor, and I was like messaging her various symptoms. I was talking with my nurse friends. I was Googling. I was, you know, seeking reassurance in all the wrong ways. And it was just, oh gosh, it was such a difficult time. I was truly so scared. Finally, I did go for some cognitive behavioral therapy, and that was like the start of the healing journey for me. And luckily, my family doctor, she did recognize that I was experiencing some health anxiety, and she had suggested this cognitive behavioral therapy. And I mean, I felt no shame. I hopped on that so fast. And I said, yes, let's do whatever we can do to ease up this anxiety. Like, I don't want to be living like this. Like, this is scary. And I see why people like dig themselves in these holes and, you know, eventually get to the point where they don't want to leave their house, or, you know, they're no longer able to work or look after themselves. I knew from the start that I was going to fight through this anxiety. But it was not an easy process. Healing is not linear. There were ups and downs. But I'm through the worst of it. And if I can help guide anyone through that dark period, then I'm more than happy. I'm more than happy to chat with anybody about anxiety, because it is terrible.
That's really good to know. And we'll leave your social links in the description of this video. So if anyone, you know, wants to have more health anxiety tips and stuff like that, then you're talking about that on there. And yeah, I'm curious as well, because you're from Canada. I don't think we've actually had anybody from Canada on the podcast.
Okay.
Forgive me, any Canadians that have been on and I've not noticed. But what is the kind of general consensus over there? What's the attitude towards things like mental health services and just generally people's attitude to anxiety?
I would say overall, like the access to some mental health services, it's mixed. Certainly there's all kinds of private counselors, and if you have medical insurance, then certainly you can access them, and you would get like a certain dollar amount per year to go towards that. I'm very lucky. I did have I do have insurance, so I was able to fund that through my insurance. The cognitive behavioral therapy that I did, it's free to anybody, and it was through one of our mental health hospitals, the what's it called, the Royal in the city in Ottawa. It's 2 hours away, but they do have people who come into like my town. So I was able to do that face to face. There is also a virtual option for that. The cognitive behavioral therapy, I believe it was a 12-week program, and I went once a week for that, and it was like an hour session. Now, to access the more intense services like psychiatry or psychology, there is quite a wait list for that here. I don't know exactly how long of a wait list. I haven't had to use that service, but I'm going to guess it could be up to a year. Now, at our local hospital here, we do have a acute mental health floor that if you needed inpatient services, you can certainly go there and be admitted. I know a lot of people don't really like that option, right? Like, you don't want to be in a facility if you really don't have to be. And it's tricky. It's tricky to access those services. A lot of people, from that I've seen in my line of work, some people with really intense anxiety, they get too anxious about the appointments, and then they don't want to go, or they cancel last minute.
Yeah.
That seems to be a tricky one. You know, it's like they might recognize that they need support, or maybe they need medication, but then they're too anxious to do it. So yeah, it's tricky. I'm not sure if that's similar to what things are like where you are in terms of services. But yeah, that's just my experience here.
Yeah, it's pretty similar. It's obviously we have the National Health Service here, so we don't have to pay insurance or anything. We just get everything free.
Okay.
But when it comes to mental health problems, there's just no funding really. It's a bit of it's not a great vibe in the UK at the moment. But again, there's a lot of private therapy that's available for people if they're able to access that. But same here. The wait lists are just so long, and I wonder how much COVID had to do with, you know, mental health services weren't great before that, but now there's just so many more people that need help that there's just not enough.
Well, from what I see, just like in my career as a nurse here, I really feel like COVID and all the lockdowns really like exacerbated the amount of mental health struggles that we're seeing. We're also seeing a lot of burnout.
Yeah.
Whether it's caregivers or teachers or health workers. I feel like every single person probably has dealt with some form of of burnout during COVID. And that leads to mental health issues. I truly believe, actually, my
Totally.
anxiety, I believe, started with a burnout. And this was before the pandemic. It was, as I mentioned, my dad had a massive heart attack. My brother was dealing with like a new diagnosis of AFib. I was trying to still work full time. I have two children, and I was still trying to do all the things. My plate was just so full. And I believe that was a big part of my anxiety onset, was just feeling burnt out. So I'm looking at all these people who have had to manage and cope through COVID. And yeah, I mean, it's no wonder. It's no wonder that the population is experiencing
Yeah.
a massive increase in mental illness. And unfortunately, I just don't think that there's the mental health professionals. I don't think there's enough of them to manage the large
Yeah.
increase. They got to be burnt out themselves.
Well, yeah, absolutely. You're totally right. And I mean, you're a nurse. So like, there's just so essential workers and stuff like that. They went through so much during COVID, still working through it and still working now and not being paid fairly in the UK anyway. There's so much, isn't there? And yeah, it's such a shame. It's such a shame that it's just, I also do think that it's not viewed the same as physical health problems. And so there's not the same amount of funding.
Yeah.
But things like lockdown and COVID, it's just shown people how unpredictable life can be and how there's things that can happen that are just totally not within our control and it can take over your life. And I think if people had never experienced anxiety before, that's bound to make you feel a bit anxious. Even the most, rock solid person is going to be like, wait a minute, everything can just change.
Yes.
And there's not much I can do to control it. And I do think things like health anxiety, or for me, I have OCD, they're almost ways to control that anxiety. If you Google enough, then you'll get to the bottom of it. Or if you do certain things enough, then you'll be able to control it and catch it early so that you have the best chance of survival and whatever it might be. But these are all just forms of trying to control things that we can't always control.
Yep. And you may get that that reassurance or that relief from those, if you do your whatever your OCD behavior or thought is, it might provide you 5 minutes of relief or reassurance, but then you're like back in the cycle. I have OCD as well. It is one of my diagnoses, unfortunately. And mine is I need to check my pulse. I need to. It's like you will see my fingers on my carotid, and I will, for a while it was 12. I had to count to 12. I had to feel 12 heartbeats. And then I'm like, okay, I'm good. My pulse is normal. And I was telling my therapist that, not even thinking I had OCD, and I could just see things turning. And I'm like, oh my goodness, I have OCD, don't I? And she was like, yeah, I think so. And I'm like, I can't help it. Even still now, I mean, I'm feeling so much better than I did at the start, but I still catch myself doing that. If I'm really anxious, you will see my fingers go, or you'll see me checking my watch. And it's just, it's like ingrained in me.
Reassurance is one of the biggest things with anxiety, whether you suffer with health anxiety or relationship anxiety or every type of anxiety comes down to, I think, reassurance. If it's relationship anxiety, we're seeking reassurance from a partner that they still love us, that they're still happy. If it's health anxiety, we're seeking reassurance from Google. And like you said, that will take the anxiety away possibly for 5 minutes.
Yeah.
But the problem with that is it's going to keep coming back until you're able to kind of reassure yourself. And that's the goal that everyone wants to get to, is to be able to say, this is those thoughts coming up again. I can see them, I can hear them. That's what's happening. But that doesn't mean we need to trust that, because the way that our brains are working at the moment is anxiety based. And so we need to, I need to learn how to, get the reassurance for myself. And that's the hardest thing to do in the world. But nowadays, when you get those thoughts coming up of, oh, wait a minute, I've not checked for lumps in a while, or whatever the thought might be, or I'm getting a sore head, is there a way that you talk to those thoughts or cope with those thoughts differently now.
Yeah, there definitely is. I no longer just automatically, my thoughts don't automatically like run to worst case scenario. Now I almost envision my thoughts in like a pie diagram, and it's worst case scenario is still a piece of the pie. It often is still something that will cross my mind, but now there's other pieces to that pie. And a big part of that has been cognitive behavioral therapy. It has helped me reframe my thoughts a little bit to see all of the possible scenarios. So for example, like if I had a pain in my abdomen, before I may used to think, ovarian cancer has to be ovarian cancer. Now I can think, okay, maybe it's ovarian cancer, but maybe it's a cyst, or maybe I'm ovulating, or maybe I pulled a muscle when I was working out. Like there's these other thoughts now, but that took a whole lot of practice, a whole lot of self-talk. And it's almost like I had to really, really, really force myself to think of the other options and to focus on the other like possible scenarios. I've read a few books about health anxiety and how it can manifest physically. And that's really helped me as well. They also have a really amazing chiropractor, and he's been able to point out some of the physical effects of anxiety and stress on the body as well. So hearing that from a medical professional has helped me along the way too. And just learning to trust my body. Those of us with anxiety, we're really in tune to our body. We can feel every little change that happens. Most of us with health anxiety, I mean, we can tell you exactly when we're ovulating. We can probably tell you where our heart rate is at any given moment in time. And for a while, that was like a negative thing for me. Now I try to view it as a positive. I downloaded a period tracker app, and here I am talking about hormones again, but it is a real factor for us females. And, if I'm having some moments where I'm feeling extra anxious or maybe having a few extra heart palpitations, I'll look on my app and be like, okay, well, my period is due in a week. So that is why I am experiencing some of these things. Other ways that I have gotten through the anxiety is going to, besides the cognitive behavioral therapy, just going to like a social worker, like a therapist or counselor, as needed. Like if I'm having a really rough time because there's some big life change, or, during the pandemic, I would do some like extra sessions here and there just to chat about what was going on. That was a big part of it. Journaling has been a big thing for me, just like journaling out my thoughts. Also, breaking up with Google. Everybody needs to break up with Dr. Google. He is not good. He's a shitty boyfriend. So break up with him. There was moments where I'm like, I feel like I should just Google this quick. I'll just give myself 5 minutes. And there were times where I had to like force myself. I was like, no, I would turn off my phone. I remember at one point putting my phone high up on a shelf, and I'm like, no, just delay it. Just give myself an hour. If I still feel like I really need to Google it, then I will. And oftentimes I was okay. I didn't need to. I also did exposure therapy to the things that really, really scared me. Like I've been too afraid to like go for a long walk by myself in case a medical emergency happened on my walk. I would be too afraid to go. For a while, I was too afraid to take a bath, because in the bath, it was like you were just forced to like lay there in the water with your own thoughts, and it would just be too triggering for me. So I started just slowly getting back to the things that I loved. Same with like watching medical shows. I love Grey's Anatomy. I loved it. But after the anxiety started, I couldn't watch it because I would focus and obsess over the medical issues and the medical emergencies on the TV. And finally, like, I'm able to do that now. I'm able to watch it without worrying. And there isn't one magical coping strategy, or there isn't one magical anxiety tool, but all of those things together, along with having an awesome support system. And I'm not ashamed to admit it, this past January, after 4 years of dealing with this anxiety, I started medication. I started a low dose anxiety medication. It was one of those things that I struggled with. I struggled back and forth. I remember a few years ago kind of debating maybe I should start medication. And I was always just told, well, you know, you're still working. You're still doing the mom thing. Your anxiety is very high functioning. I feel like maybe my medical team didn't believe it was as bad as it was because I was putting on that brave professional face. But finally, after having COVID in October, my physical body was a little different. I did experience a lot more heart palpitations after COVID. I'm talking like thousands of heart palpitations a day. And that caused me a lot of anxiety. And it's like my anxiety peaked again. I was getting to that dark place again. And I thought, I can't do this. Like my coping mechanisms just weren't, they weren't getting me back to my new normal. So I thought, you know what? I'm dropping the stigma. I'm dropping the shame. I'm going to call my doctor and just ask for like a low dose medication. And honestly, like a week later, it was life changing. It was the best thing that I ever did. And I think a lot of people maybe are in denial about needing medications, or they feel ashamed about it. And I wish it wasn't that way. There shouldn't be the negative stigma around being on medications for your mental health. I feel like there still is. And even me, even as like a medical professional, it was a really hard decision. It was a really hard call. And even whenever my doctor gave me the prescription, it took me another few days to actually go to the pharmacy and get it. And you should have seen the first day that I thought, okay, I'm taking it. I was freaking out. I had a panic attack. The minute I swallowed the pill, I full on had a panic attack and thought, what if I'm allergic to this? What if it like changes my brain and makes me crazy? And it was ridiculous. But anyways, it's now been a few months, and I only wish I did it sooner. I really do. It's been truly life-changing, and having that bit of medication in me allows me to focus more on the other tools. Like it allows me to go to yoga and be present at yoga and not have my mind racing. It allows me to go for a walk and like get the benefits of nature and that exercise. And it allows me to like reach out to my social supports without fear. Like it's just, I don't know. I can't say enough. And if you're someone and you think that maybe you do need medications, that maybe it's time and your mental health is negatively impacting your life, then maybe it's time to talk to your doctor about it.
Yeah. That just sounds like because I always say that there's the same that you've just said. There's no one cure. There's not going to be, and as soon as somebody says, I've got the cure for anxiety, then walk the other way, because if you're somebody that's struggling with anxiety, there's going to be lots of little things that build up the way that you cope with it. Like you said, support systems, medication, different types of therapy. You said chiropractor. There might be acupuncture, massage. There might be, different books that you mentioned. There's so many. And like, I love that you said pie chart, because it really helped the vision in my brain of like a pie chart. And when you're talking about like pie chart of probability of whether this is cancer or whether this is, digesting your food even, the same with, recovering from something like anxiety. I'm seeing a pie chart or a puzzle or something that has, different, 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 maybe therapy for you helps 3% and then medication helps 54%. And then, there's just like so much wiggling around, and there might be something that your best friend takes every day and you absolutely love it so much, and for you it doesn't work. There's no one size fits all. It's not the same as a broken arm. It's like just so different for everybody. And would you mind sharing what medication you're on? I'm personally on citalopram. Just for anybody that might be listening that's like, whatever she's on, I want that.
Yeah, no problem. So I'm on escitalopram. I don't know if it's the same, but it's citalopram with an E and E as at the start.
Okay.
We call it Cipralex here. I believe in the States they call it something else, but it's Cipralex. And I'm on the smallest dose that you can be on. And it's wild how much of a difference it has made. Like I said, like within the first week, I started noticing some improvements. And it's funny, it's kind of ironic, but at first I was like, I remember noticing, I was like, wow, I don't feel anxiety right now. And then I was like, where's my anxiety? And then I started like worrying.
Yes.
I started feeling anxious that I didn't have anxiety because it became my norm. And it's almost like through this anxiety recovery, I've gotten to like know myself again. And I've started to develop like new habits, new ways of thinking, and just getting to know myself and trusting my body again, because my brain isn't full of these anxious thoughts. So now I'm like replacing those anxious thoughts with more, we'll say, like realistic, logical, positive thoughts, being able to feel some excitement about upcoming events and future plans. It's really been amazing. And like you said, like anxiety recovery and the tools, it's so different for everybody. And I think that the important thing to note is that it's not a quick fix. Like, it is definitely not. Like, this has been 4 years and it's not linear. Like, I still have my days where I just, I kind of feel a little rotten, maybe a little down, a little anxious. Weather can play a big role if I'm sick with a virus of some kind. And I mean, the hormone thing, if I'm PMSing, I usually do have like a day or two where I just don't quite feel like myself. And that's all normal. Like, I would say even people who don't have a formal anxiety diagnosis, everybody has their days. So it's just been important for me to like not beat myself up when I do have like a negative mental health day, just to remind myself it is normal and it'll pass.
Yeah. 100%. Yeah. It's been so nice talking to you, Shawna. It's been a really positive story that you shared. And, I just want anyone that's listening that has health anxiety specifically to, go over and follow Shawna, because she's talking about this kind of stuff a lot. And you're very open, and it takes courage to be open like this. It really does. It's not easy at all. And I'm sure it really, really will help people. So thank you so much for coming on.
Well, thank you for having me. This has been really great.
Good. I'm glad you've had a nice time. And if you're listening and you'd like to come on and share your story of anxiety, it's honestly not as scary as you think. We'll have a really great time.
It's not.
If it's something that's a little bit too much for you, you can also share your anonymous story if that feels a bit too much. We'd love to hear whatever story it is that you'd like to share. And thank you all very much for listening. We'll see you soon. Goodbye.
Thank you.